Welcome. I'm Doug Seserman, privileged to serve as the CEO of Americans for Ben-Gurion University. And it is Tuesday, but it's hashtag Webinar Wednesday, a special Tuesday edition of Webinar Wednesday on the COVID Omicron variant. And we're bringing to you live from Israel, Professor Nadav Davidovitch, who's been a regular on our show, if you want to call it. But Nadav, this is incredible. We had over 600 people register for this webinar with just a few weeks notice. So obviously either you or COVID are a big draw, maybe it's both. So we're just so pleased that you joined us. I want to thank everybody behind the scenes, Melody Mokhtarian, our Director of Events and Experiences, Lior Kajdan, and also Ali Robinson. We are live on Facebook. So this is just an incredible time in history, and I also want to apologize to the audience. I'm a little under the weather myself. Recently got back from a business trip. I'm waiting for my test results on COVID, hoping that it's negative, but I'm definitely under the weather. Okay, so Nadav, we had a lot of community partners that we want to thank. We had 10 community partners that helped us generate awareness for this webinar. Here's the list. We thank you all across the country, this great list of partners. And remember, our goal here at Americans for Ben-Gurion University is to partner with organizations that care about Israel and bring some of the best of Israel and increase the awareness of the best of Israel in a part of the country, the Negev, that nobody's arguing about. We really represent everything great that's happening in Israel, and we're going to talk about the science behind COVID. So thanks to the community partners. I also want to do a quick shout out to my colleague, Mark Mendelson, and all the associates at the Canadian Associates for Ben-Gurion University, who are also promoting this webinar. We have people from across North America and all over the world, certainly in Israel, joining us today. So for those who aren't familiar with this format, if you have a question, just click on the Q&A function, and we'll do our best to get those questions answered. This webinar is called for 30 minutes. Nadav is going to talk for about 10 minutes on some recent findings and a presentation he made yesterday to the Knesset, actually. And then we'll open it up to Q&A. So if you have a question, just click on the Q&A and we'll do our best to get to those questions. We know that this subject is really important to people, and so this webinar may go a little bit long, and I'll just watch the audience participation and see, try to make sure that all questions are answered. Okay, so Professor Nadav Davidovitch, this is his fifth webinar with us and our 43rd in total, but you are the director of the School of Public Health at Ben-Gurion University of the Negev. He is also the chair of the Center for Health Policy in the Negev and an advisor to the Israeli government on coronavirus policy. We at A4 BGU, Americans for Ben-Gurion University, lovingly refer to Nadav as the Dr. Anthony Fauci of Israel. He represents Israel at the European Public Health Association and recently became the interim chair of the Israeli Association of Public Health Physicians. Professor Nadav Davidovitch's research focuses on various aspects of health policy, combining his multidisciplinary training as an epidemiologist and public health physician with his research expertise in sociology of health and public health ethics. He's involved with several research projects related to the legal and ethical aspects of public health practices, including pandemic response. He was a reserve medical officer during Operation Protective Edge in 2014, and in that capacity, he was the commander of a medical unit with 700 physicians, paramedics, medics, and other medical personnel. Nadav received his M.D. and Ph.D. from Tel Aviv University and his master's in public health from Ben-Gurion University. Nadav, welcome to hashtag Webinar Wednesday, special Tuesday edition on the coronavirus.
Thanks so much, Doug. It's a great honor and pleasure. We are again, unfortunately, in kind of difficult times. I know that the situation in New York also is quite sensitive. I'm also want to say that unfortunately we have officially now the first death of Omicron in Soroca. A man in his 60s with risk factors, and just now the genetic typing came back, it's Omicron, and he was vaccinated twice 8 months ago. So it's showing us the importance of having the third dose, because it's quite clear that having the third dose, even for Omicron, it's protecting you from severe disease and death. So please go and vaccinate. Also children. We have now very good experience in Israel and in the US. Children age of 5 to 11, side effects are very low. And although the risk in COVID with children is lower, it's still, you can have PIMS, you can have long COVID and many other risks. So please go and vaccinate. I want to show you from a presentation we did yesterday at the Parliament. It's in Hebrew. I'm not going all through the presentation, but taking some highlights to give you some understanding of the context. So this was presented in the Constitution Committee. They are making, after we giving all the recommendation, it need to be approved by the government and then approved by this committee. And just to show you that this is the rate of positive tests, and we are going up. Today it was even 1.3%. So things are moving. We were around 0.5%. Now it's 1.3% today. And even the R coefficient today is already 1.22. Yesterday it was 1.14. So we are going up quite quickly. I want to show you here about the Omicron. It's in Hebrew, but the whole idea that the speed of transmission is probably 4 times more. The R coefficient of Omicron without any measures is 7. The original COVID was about 2. Delta was about 3.5, and now it's about 7. Again, without any measures. Of course, when you get vaccines, when you get masks, when you get other things, you can reduce it. Now, the question: what would be the combination of how the speed of infection and then how severe the disease is? So even if the disease will be 50% less than Delta variant, when it's 4 times quicker, you can understand that the burden on the healthcare system would be tremendous, because finally it's about the speed of infection and also the clinical signs. You can see the spread of Omicron around the globe. It's spreading now very, very quickly. And you can see countries now that were turning red, meaning that for us in Israel, those returning need, first, Israelis now are not allowed to go there. And also you need now 7 days of, even if you're vaccinated, you need 7 days of quarantine. And you can see the prediction, the proportion, how it's being predicted around the globe. It's very, very steep and going up very, very quickly. And you can see here what's happening in different countries. These are the numbers of Delta. You can see here in the US, and here in South Africa, you can see that the Omicron is replaced already Delta. And probably this is what's going to happen quite soon in the US, in Israel, in other countries. The multiplication rate is in about 2 days instead of 7 to 10 days, like it was with Delta. It's very, very quick. See what happened here in the UK. And you can see the Omicron R coefficient is 7.2. It's going up very, very quickly. and again replacing the Delta variant.
Nadav,
And
you've already broken a record. We have 11 questions already, but one question is why do we know why Omicron is so transmissible?
yes, the Omicron actually is a very efficient variant. There are hundreds of variants. Most of them are finally not getting any attention because the mutation are creating a virus that is less transmissible or not relevant or not replacing the dominant variant. What happened with the Omicron is that there are more than 30 mutations on its spike protein, the region on its RNA, and it created a spike protein that is attaching much better to the respiratory cells, and also the replication rates are much higher. Probably the clinical symptoms would be lower, but again, when you have something that is spreading 4 times quicker, even if you have a reduction of 20%, 40%, 50%, still on the population level, especially people that are high risk, you can see that probably many of them will be hospitalized. You can see what happened here in Denmark, the proportion of Omicron variant very quickly. And you can see that both in Denmark and Norway, there's a prediction of drastic spike in Omicron cases, similar things in Canada. And probably I'll stop here. So I think you got the picture that why this happened. This happened because we have huge gaps in vaccination rates around the globe. And I'm sorry to say that this is a failure of global health governance. I can show you that we discussed it already last December. I'm part of the executive committee of the European Public Health Association and other European committees. We sent letters, we wrote articles, and the current pharmaceutical industry kind of market failures are hurting all of us. In the state of emergency, we need to see how intellectual property and patents, by the way, many of these, are based on developments in the public academia, in Germany, in other places. And the fact that we have vaccine nationalism and not vaccine internationalism, it creates such gaps. And in South Africa, for example, because you have this combination of low vaccination rates, about 25%, and very high rates of HIV/AIDS, so you have the case where people that are high risk, being infected, they can suffer from chronic COVID-19 infectivity, and then within their bodies, there is a fertile ground for developing new variants. This time, again, this is something happening all the time, but because of the evolution and this random effect, finally you can have a strain that is much more, a variant that is a variant of concern. And this is how it was defined by the WHO, mainly because of the changes in the spike protein. Now, when there are such changes, you have 3 factors. One is transmission, and we see that transmission is much higher. Second, the clinical effects, and probably it's less severe. And 3, and this is the $1 billion or $1 trillion question about vaccination efficacy. I can say that it's clear that when you are fully covered with 3 doses, you are less susceptible for severe disease, hospitalization, and death, and probably you are less infective. But this is not 100%, and this is why even people that are vaccinated can have this kind of a breakthrough. So what we're doing in Israel and what I think will be now around the globe, the most important thing is vaccination. But this is not enough. Public health, I think you know, and I told you already in our previous webinars, is not just about counting COVID cases, it's also about the mental health effects, long COVID, issues such as the economic influences. So we need to be proportionate and see how we can add on top of the vaccination also different aspects such as use of masks, green pass that should be also proportionate. I don't think that the green pass is to enforce someone to vaccinate. It's more about creating safe places and some limitation on gathering, especially in closed spaces. So Israel now is moving probably to 50% workers coming to government services. Medical conferences are now not allowed anymore since yesterday. It was a letter from the Director General of the Ministry of Health, Professor Nachman Ash. And I'm sure that many of you are asking about, having a trip abroad. We are just before, the new year, Christmas, etc. Please make your celebration at home. I don't advise you to travel, even if it's allowed. I don't think that in democratic countries we can, negate this option. Sometimes you have a funeral, sometimes you have a wedding, a bar mitzvah, I don't know, bris. So take your considerations. Israel now is blocking non-Israeli citizens entering. I think this was a good move. I mean, it's a very radical move, but it was good in order to gain time. I think that in a week or two, this will be not relevant anymore because Omicron is already in Israel. And I think that on the long term, all these travel restrictions are losing the potential to limit the spread, especially when it's spreading so fast. I want to say with proud that Israel now is covered with sewage surveillance. I think maybe I mentioned it in our previous meetings. And I'm also very proud to say that Professor Kobi Moran Gilad, Professor Ariel Kushmaro, and myself, we are on the team doing the sewage surveillance in Israel. We started also working with other countries, including the UK. And I think this has a tremendous potential. By the way, we saw now in the sewage surveillance that Omicron is already spreading much more than we saw in other means. And maybe the last sentence, Doug, before the questions, I think I told you already, COVID is a mirror presenting us, all the inequalities in our societies. And that's something we need to remember. We're just going to publish a report showing how in all vaccinations in Israel, and this is true also around the globe, the first dose, second dose, third dose, all ages, you have socioeconomic gradient. So we need to be much more active in vaccination. And I'm very happy that although late, but we started vaccinating in schools with the mobile units, especially in low socioeconomic cities. I think that's very important.
Thank you, Nadav. You've clearly broken a record. We have 35 questions in queue. So I'm going to do my best to sort through or to aggregate them together. Some of this you've already covered, but we're getting some questions around testing. If people have received a positive from the fast result antigen test, do they also need to do a follow-up with a lab PCR just to confirm that they have COVID?
Yes, definitely. You can have both false positive in this case or false negative, and the definitive results is the PCR. Also, when you're doing the PCR, you can do also the genetic typing because the antigen test is just, testing on the protein level. So yes.
And if people are getting questions around people feeling sick, but they've had a negative test, should they be self-quarantining anyway?
Okay, so that's an excellent question. We need to remember that there are other things going on right now, and unlike last year, at least in Israel and other places, influenza is now very prevalent. So in general, people are not feeling well, they have fever, cough, etc. Yes, but this is not related to COVID. And that's something that, especially in Israel, we have this problem that we are going to work sick. Even the healthcare workers, we did a study on that because we don't want to hurt, other people. But that's a problem, and especially now when you have a wide transmission. And if you have the signs, I would not just do the home test. I'll do also the PCR.
Okay. We're getting a lot of questions, and you answered some of this in your talk about the breakthrough cases, and that two shots from the vaccine is not giving enough protection. And there was some reports recently. The Pfizer CEO Albert Bourla, he reported that with the third booster, then you get the same level of protection of the first two. And there was a report that came out recently from Moderna that their booster shot gives you, I think, 38 times or 37 times more antibodies. So just people are asking about mixing and matching the different pharmaceuticals and just the overall importance of the booster, and that if you do have the booster and you get sick, what will the effect be?
So if you have the option to get the same manufacturer, it's better, but you can now for sure, and it's already approved by the WHO and FDA, that you can mix. It's probably better to mix with the same kind of vaccine, so messenger RNA, so Pfizer, Moderna. But if you don't have access to, and it's more than 5 months since your second dose, so get AstraZeneca or any other vaccine that is available. There are now 9 vaccine types that are approved, including the Chinese vaccine. So again, we're talking here people from the US, so I don't think the problem to get. So yes, you can mix, but if it's relatively easy to get the third dose with the same manufacturer, so probably better. But especially if it's the same technology like messenger RNA, so shouldn't be a problem. And indeed, after 2 doses, especially if it's a long time, you're getting down and up to 20-30% protection versus up to 90%. Now with the Omicron, it's clear that you're protecting yourself from severe disease, but not from but maybe less so from a breakthrough. But that's a big difference, you're keeping yourself from being hospitalized or even dying. So it's a big difference.
Getting questions about if somebody is vaccinated and they get COVID, are they as infectious as somebody that's not vaccinated and gets COVID?
Yes. Because we're not just talking about 0, 1, it's also the amount of the viral load. So when you have less viral load, even if you're positive, you're less infected.
So there's absolutely no science whatsoever supporting not being vaccinated. All the science says get vaccinated and get boosted. I mean, if anybody is not getting vaccinated at this point, go ahead.
I want to stress, we have now enough data, and I'm very proud that many of it is actually from Israel, and also lots of involvement of Ben-Gurion University scientists, including also Professor Ran Baliser. He's a professor at the School of Public Health at BGU, and others. And we're also presenting the data to the FDA. And we changed the FDA view about the third dose. And really, Israel was a pioneer here because we saw the data and we started to vaccinate first. There is no way to say it. I think it's irresponsible not being vaccinated right now. And I really urge you, like I'm talking with my family and close friends, go and vaccinate and have the third dose. Now, Probably people are asking themselves about the fourth dose. So I need to say that this is something that we are checking now in Israel. It's clear that the third dose is giving you much longer protection. But yes, there is an option that maybe we'll need the fourth dose, probably an adapted one. But we are still looking into it. There is a study now at Sheba Medical Center on healthcare workers with the fourth dose. The results will be probably available in the coming weeks. I guess that the fourth dose will be mainly for high risk, very high risk groups. But for now, there is no recommendation for a fourth dose, unless very specific immunocompromised people, especially organ transplantation, that maybe it can be helpful, but this is a really very, very tiny, small part of the population.
Andrea Gorin, our treasurer, he's asking, Andrea, he's asking that there's what seems to feel like almost a test panic in New York City, where you've got lines of people trying to get tested. If you've had exposure and are asymptomatic, is it really important to get a test right away?
Yes, it's important because probably you have people that were in contact with you and they also need to be tested. So yes, it's important. It's also important that you'll be recorded. If in the coming future, we're going to see that Omicron, it's almost nothing in terms of its clinical symptoms. So maybe it will be different, but that's something we cannot say right now. And again, I just said that someone in Israel, the first death, it just happened. So it's important to be tested.
All right, we're getting, this is the first time we're getting questions live from Facebook, Nadav, and we're up to 52 questions. So we're going to go a little bit longer today. We're not going to get to everything. We might need to bring you back. We're getting a question from Facebook. Is it safe to eat indoors?
I think we are coming to the place that's probably less so. Up until recently, with the Delta variant and people being vaccinated, so we were using in Israel and I think also in the US the Green Pass. But currently, in the current situation, probably soon we're going to have some limitation also when using the Green Pass. So we need to adapt. Again, it really depends on the space, how many people are inside, what's their vaccination status, etc. But unfortunately, again, probably in the coming weeks, we're going to return to some of the limitations we had that we remember, months ago. And I know that we have pandemic fatigue, and I know it's not easy. But I think it's prudent to say that, if you can limit your exposure, especially if you're a high-risk group. So the answer is yes, do so.
Okay, we're getting questions around what's next after this. So some have said that Omicron might be signaling the end of the pandemic, or what people call the endemic. What do you see? Do you see a strain that might be even more virulent after Omicron, or because this is highly transmissible but not as dangerous, is that actually a silver lining?
This is an option. Nobody can tell right now. I can only say that finally, yes, COVID, and I think I said it already more than a year ago, COVID will turn to be endemic. The question is how long this is going to take. I'm sure also that COVID vaccines will be part of the regular vaccination schedule, like we're doing for influenza. There is a good chance that maybe we'll have an annual vaccine that will be adapted. And I can assure that we are going finally to get over COVID. I know it looks now very stressful, but I think that if we're going to learn many of the messages, the amazing science of the messenger RNA, the importance of public healthcare systems, the importance of an integrated approach for emergencies. So I think that this will be a good lesson. And also, I'm much more afraid about the effects of climate change on health. So some of the lessons here, move away from national responses to international global health governance and take an integrated approach related to the sustainable developmental goals. And finally, these are very important messages that I hope that we are going to adapt.
Getting a couple of questions about if you've had a breakthrough case but didn't get your booster and you recovered from COVID, should you still get the booster?
So before the Omicron, the answer was no, you don't need. But again, we are learning as we are moving ahead, and people that recovered right now, they need at least 3 months before getting the booster. So I think in 3 months, we're going to have much more information to answer that.
Let's talk a little bit about the endemic. In the future, do you see an annual flu shot for COVID?
Again, it's hard to tell, and I'm being recorded, but probably yes. I think that we're going to have an adapted version. I hope the first adapted version will be out in the coming weeks or months, adapted for Delta and Omicron, including the different variants. There are other variants as well. And I think that probably we're going to have an annual vaccine, but this is very early and it's really hard to say. It's a probable option, but really nobody knows.
A couple of questions. First of all, Jane wrote to me saying that she hopes I feel better. That's really sweet. We're getting a couple of questions about mask wearing. Just, is it really important if you're triple vaxxed to continue to wear a mask?
Extremely important. Extremely important. I need to stress it, especially when you are in closed spaces, or maybe when there are a public gathering outside. Especially when you have widespread community transmission, like now. I don't think we're going to wear masks, forever. But masks are exactly for the situation we are now, that is widespread community transmission, especially in closed places.
Well, I saw Fauci talk about that he thinks that it will be really permanent that people wear masks on airplanes and probably public transportation.
Probably it's a good idea. In the Far East, they're doing it already for years, especially after SARS. I think that this is especially important for people that are high risk, maybe suffering from a different chronic conditions, and probably especially in flights that are taking longer. By the way, in flights you have a ventilation system, so maybe trains, buses, even more important. But again, this is much more when you have community transmission, not just of COVID. It can be also during the winter when you have flu. So that's something that we need to consider. Like we need to consider much more and take much more seriously the question of ventilation that we didn't. Even now, by the way, only recently, Prime Minister Bennett, demanded that there be a ventilation system at schools, and that's something that we suggested the advisory committee already more than 1.5 years ago. That's another important tool.
We're getting some questions about the relationship between the flu shot and the COVID vaccine. Does the flu shot in any way give you protection toward COVID or vice versa?
There were some anecdotal studies. I think this is right now more theoretical. You need to get both, and you can get them together. It's no problem. Yeah, so that's the current knowledge.
Getting a question about should synagogues still be having in-person gatherings, or is that safe or no?
It's an excellent question. They need to be discussed. I think in some time we need to go back to the practices of, again, in Israel, it's easier, although now it's raining here, but usually it's much easier probably in Israel than in New York to have prayers outside. I found it also as a kind of unique, even elating experience.
Yeah, so we're more spiritual to connect with God in God's space.
You know, there is in the Bible, you have this phrase that Vayetze Yitzchak lesuach basadeh, that Isaac went to the field, and Rashi said that he was then making the mincha. So going and praying in the field, I think, yeah, it's. I participated in many of these, and especially also in high holidays, and it was actually a nice experience.
Very nice. So getting a couple of questions, and then we're going to just need to wrap up on this sewage surveillance. Just remind people what Israel's doing and how that's helping you understand where the hot spots are, if you will.
Sure. So sewage surveillance is not new. We have it in Israel, especially for polio. This is how we found the silent polio outbreak in Israel. Silent because everybody was vaccinated, but we find it in 2013. And the idea is that since COVID is excreted also in feces, in the gastrointestinal system, and of course, you don't need informed consent to to test the sewage. So you can do the test. You can collect it. It's quite complicated how exactly to do it and how to calculate the quantity, because you can imagine that it has lots of variables there. But you can say positive or negative. But not only that, you can try to define, you know, is it a low excretion, high excretion? You can go up upstream, and let's say you're taking a certain part of the city, you can define the specific neighborhoods or even smaller parts. And now also you can define it's the Omicron excretion. And what we saw in Israel in the last 2 weeks, that there is already wide community transmission, and we started to see Omicron in the last few days that wasn't there before. So it can give you many signs because since we have so many asymptomatic cases, that's something that you can really see. It's more complicated because you need to adjust, for example, the Delta variant, the excretion was the viral load was much higher than the previous Alpha strain. Now with the Omicron, probably also higher secretion. So there are lots of scientific issues, fascinating scientific issues there. But sewage sampling actually can help you with the opioid epidemic, you know, to see its excretion, antimicrobial resistance, many amazing things. And it's something that was quite neglected for a long time.
Okay, Nadav, we're going to wrap up, but I'm going to let you have the closing comments. You know, it is December of 2021. It's not March of 2020. We've made a lot of advances. We've got the vaccines. This webinar had a lot of, challenging information that is uncomfortable for people, but it's the reality. Just give us some hope around what you
We
see
have all
coming.
the tools to learn and live with COVID. It's going to turn to be endemic. We must have a broad public health perspective, not just counting COVID cases, but taking also other factors into consideration, be proportionate. And we really have all is needed. We just need to apply it. We need compliance. We need the government to be responsible. And I think that, again, we have so many lessons that can be applied later, home hospitalization, telehealth, many amazing things that, were accelerated. And it's really up to us to see that this is going to be sustainable. Lessons related to the collaboration among different countries. And I hope we learn those lessons for the coming challenges. And I can tell you that in terms of Ben-Gurion University, Doug, I published this year 30 scientific papers. This is about twice the amount that already was quite high. So it was a very fruitful, crazy, hectic year. Also learned to work sometime from home. And I think this can have also its advantages. Of course, this is working for me. We need to see that it's working for everybody, including, vulnerable people, vulnerable groups. And we need to think about public health as related to human rights, inclusion, and not just about exclusion and, aspects that can be really very, very problematic on the social perspective. And if we have this integrated way of thinking, we can really move ahead.
All right, thank you so much, Nadav. Thank you to the audience. We had great audience and over 600 people that registered. We've held our audience the entire time. Please join us for our next webinar on January 26th about getting a degree in Israel. Next year in Israel, in Beersheba, pursue an MBA or an MD. Programs all taught in English, targeted for North Americans. So that's a webinar we're going to be doing on January 26th. Also, if you'd like to get more involved with us, please go to our website, americansforbgu.org. We'd love for you to be involved with us locally, nationally, in whatever way you would like, and to get the organizations you work with to also partner with us. So thank you for joining us. David Ben-Gurion, Israel's founder and first prime minister, and who we are proud to have as the namesake of our university, once said when referring to BGU, that we seek to build a scientific research and teaching center which will be a source of moral inspiration and courage, rousing people to a sense of mission, noble or creative and fruitful. In many ways, Professor Nadav Davidovitch represents all of those elements in one terrific, brilliant guy. So thank you, Nadav, for joining us today. Everyone, stay safe and be healthy.
Thank you so much. Lots of health and happy new year for a better year.